All right. Hello, everyone. Welcome to the MYAC Talks Mental Health Summit, and thank you for attending today. I'm Hannah Shalom. I am the chair of the Mayor's Youth Advisory Council, and I'm going to be emceeing and running this mental health summit today. I'd first like to welcome anyone who's joining in on Facebook and, just tuning in. We appreciate you being here, and these are some very, very pertinent issues, and we appreciate your attention. I'd also like to welcome, we have several MYAC members who are going to be speaking for us today. So we've got Sophie Robbins, we've got Caitlyn Holdeman, and we've also got Sarah Gonzalez. All right. And also today we are going to be having a panel, and I will introduce those panels in a minute. This past year with COVID and all of the other craziness that we've experienced, there's been a lot of concern about mental health in our youth and in our adult population, just being secluded inside and having to deal with so much unrest in the world right now. We felt this was a very pertinent issue to talk about, and we thank you again for being here. So I'm going to introduce our panelists, and then after that, I'm going to give them the opportunity to unmute themselves and give their own introduction. So first off, we have Leigh Flynn, who is the director of the Idaho Suicide Prevention Hotline. We have Shauna Manhire, LMSW with Victory Middle School, Brian Huck, LCSW, Kim Kane, Project Director with Idaho Lives, and Officer Ashley Horvath, who is an SRO with the City of Meridian. With that, I'd like to give you guys the chance to introduce yourself, your background, and your affiliates.
Certainly. I'll go ahead and jump in since you started with me. So again, my name is Leigh Flynn, and I'm the director of Idaho Suicide Prevention Hotline. And I'm really, really pleased to be here today. We appreciate the chance to visit with communities anytime we are able. And I've been at the hotline for 1 year, and just really excited to be working with the great team. I'll just put in a little quick plug about the hotline. Most people have an understanding of the hotline, but I just want to emphasize that Idaho Suicide Prevention Hotline is 24/7. People can reach out via phone, text, or chat. And we do provide crisis intervention and suicide prevention support. A person does not have to be suicidal to call us. In fact, we get most of the people who call us are not feeling suicidal, but they are feeling in a different type of crisis. So thank you again for inviting me.
Yes, thank you for coming. Shauna Manhire, would you like to give your introductions?
Absolutely. Hi, I am Shauna Manhire, and I am currently working as a middle school counselor in the Meridian School District. And I have worked in mental health since 2003 in various aspects as a social worker and as a school counselor. And currently, one of my big projects here at Victory Middle School is working on suicide prevention with a program known as Sources of Strength, and just getting the word out with students and families about how to manage those feelings of stress and being overwhelmed in a positive way, so that, we can move through those hard times without getting to a place of being suicidal. And then if you are at that place, working with students and families on how to access resources to prevent, taking action and finding a place to find some hope and recovering from those situations.
Thank you so much. Brian Huck, you're next.
Right. Again, thank you so much for giving me this opportunity. I'm excited to be a part of this panel and honored to be on with all the other panel members. So I'm a LCSW. I have a private practice in Eagle, and then I also work for St. Luke's Children's Center for Neurobehavioral Medicine. So I'm a mental health counselor, 1 day a week for children and adults, and then the other 4 days with children and adolescents. And yeah, I definitely hear and recognize a lot of the stress, Anna, that you shared with the change in routines that people are going through, the kind of unknown associated with COVID. It's caused a lot of disruption in the full spectrum of people's lives. So thank you.
Thank you. We appreciate you being here. All right, Kim Kane.
Hi, my name is Kim Kane, and I am the project director for the Idaho Lives project. I have been working in the field of suicide prevention for about 17 years now in various capacities, and currently the Idaho Lives project, which focuses on youth suicide prevention up to age 24. And I'm really excited to be invited today. I've got resources I want to provide for parents regarding suicide prevention, guidance for talking with their children, and also just ways to build hope and resilience in tough times. So thanks for inviting me.
Thank you so much. We appreciate you being here. All right, and last up we have Officer Ashley Horvath.
Good afternoon. My name is Officer Ashley Horvath. I am a school resource officer with the Meridian Police Department and also work as part of our crisis intervention team with the Meridian Police Department as well. Super excited to be here and answer any questions that may be related to, how law enforcement may be involved with those youth or other community members who may be going through a time of crisis, and some resources that we can also offer.
All right, thank you so much. And I know the slide is already up, but we are going to bring forward Leigh to introduce the resources just at the beginning in case anyone finds that while watching this, they are in immediate crisis.
Certainly, yeah. For anyone that's tuning in tonight, we just want to let you know that if you feel like you want to talk to somebody during this presentation, please reach out to the hotline. The numbers are on the screen. It's you can call 800-273-8255, and you can also text 208-398-4357. And please, if you feel like you want to talk to somebody or have someone listen to you, reach out anytime.
All right, thank you so much. So when we were planning on doing this mental health summit, we talked to many of the MYACers, and we tried to get a good survey of the topics that we felt would be most relevant and most pertinent today. And we decided upon a few topics. And before we jump into the panel, I'm going to bring forward a few MYACers to discuss the topics that we chose to discuss. So first up, we have, I believe it is going to be Caitlyn Holdeman speaking about stress.
Yeah, so stress is very apparent in our lives currently and has been that way for over a year now. Also, stress can be a constant in our lives, especially if you struggle with any anxiety disorders. I personally have 3 basically anxiety-driven disorders. So I know a lot of what it's like to struggle with that. And there's a multitude of different ways to cope with stress. Sometimes even talking about stress like this can alleviate some of it. For all of these reasons, we decided to include this topic in the summit.
Thank you so much, Caitlyn. Next up, we have Sarah Gonzalez talking about isolation.
Okay, so MYAC chose the topic isolation during quarantine because we felt that many youth have struggled with the feeling isolated this past year. During quarantine, youth weren't able to see their family or friends, and most of them were stuck with their household. I know for everyone, it was different experiences, and I can only go off my own experience. But during quarantine, I grew distant with friends and became more introverted than usual at school. And since I got back to school, I've noticed that more youth have lacked social skills, and many people, there's a lot of people all together, and it's kind of seems exhausting. So I was wondering how we could cope with feeling isolated during these times.
Thank you so much, Sarah. Next, we're going to bring forward Sophie Robbins to talk about why we chose our next topics.
Yeah, so this is going to be about how parents and fellow students can help each other. So I've personally seen through my friends how mental illness really breaks down communication, especially within families. I've known a lot of kids who were scared to even breach the topic of depression or anxiety with their parents because of fear of stigma, and then they turn to their friends. I've had countless times when close friends have shared suicidal or self-destructive thoughts with me, and I've had no idea how to proceed or get them help. They don't think that their parents will react well, and to be honest, they normally don't. I think a lot of parents get freaked out when they think that there might be any issues with their child's mental health and might not react the best in the moment. Because of this, I think it's really important for not only kids to know about their own mental health, but also for parents and guardians to be able to recognize symptoms and for teens to be able to spot them in each other. We hope that being able to open up this conversation for parents and peers, we can help create better informed individuals who can help their children and friends when it comes to mental health.
Thank you so much, Sophie. And lastly, we wanted to discuss the topic of suicide and suicide prevention. Most of us know someone that has taken their own life or someone who has been directly impacted by suicide, not just youth suicide, but that is what we would like to focus on today. I personally have known several people who have taken their lives, and I have also had several friends who have attempted to take their lives, and it's a very difficult situation that no one quite prepares you for. Coping with peer suicide is a really difficult topic that I don't think is discussed enough. And therefore, we decided that we wanted to close off our discussion today talking about peer suicide and how to help prevent that, not just as an individual, but also as an organization and a community. So with that, I'm going to open up the panelist discussion. We're going to start off on the topic of stress, and we have curated some questions here. I'm going to bring back Caitlyn to read these, please.
Yeah, so we have 3 basic questions. How do we best cope with stress? What societal factors cause anxiety? And how do we know if our stress is more than just stress and actually anxiety?
The panel is now open.
That sounds like a good question for Brian.
Yeah, I would love to hop in on this and start the discussion here. So I'll try to just go from this top down. So how do we best cope with stress? I think first it's important to know, that we are stressed and to be able to recognize that stress. One thing that often happens with stress, that some of the first things to start to change, right, are that we start to forget about those primary needs. So oftentimes people who are stressed will start to sleep less. So there's disruptions in their sleep. They may start to eat less healthy, and they may then, also not get the fluids that they need. They may neglect like drinking water and things like that. And so one of the best coping skills, or a good coping skill, is to make sure that we're doing those things, right? To make sure that we are hydrating, make sure that we're eating healthy, and make sure that we're getting sleep. So that's, requires a good sleep hygiene is what they call it. It means good sleep routines, that we're not on screens late into the evening, that we're getting plenty of exercise, physical exercise and mental exercise during the day, and that we're winding down in the evening. So those are kind of the basic factors that are really important to make sure that we're addressing. There's a lot of additional ones that definitely we could look at, making sure that we're doing something pleasurable each day, like being involved in, and I know with COVID, it has been difficult. One of the nice things is we've still been able to get outside and get some exercise. Exercise is one of the You know, I like to call it the kryptonite for stress. Exercise helps be able to burn off some of the endorphins that we make when we're stressed. And so that's one of the, that's one of those other things that it can be very helpful. As far as what societal factors cause anxiety, well, so to understand anxiety, and stress, oftentimes is where we feel that the pressure or the situation outweighs our ability to be able to handle it. And you see that in that some people that we know may not be anxious about, you know, the same thing that somebody else is. And a lot of times that's based upon what your thought or what your belief is about that thing that is causing you anxiety. If we feel that, if we think about it, if we have the confidence that we can handle that situation, we're going to experience significantly less stress and anxiety about it. It's when we have a belief that we're unable to handle it, that anxiety then has room to kind of grow and manifest and get bigger. And so obviously, you know, societally with COVID was a huge thing. And there was a lot of anxiety because there's a lot of information that people didn't know and we still don't know. And so seeing that, I think from, you know, for adolescents, I think particularly this is distressing because we generally look to adults for answers. And there are a lot of adults out there who are pretty inconsistent and didn't have good answers. And so that can cause a lot of anxiety in and of itself. Let's see. And how do we know if our stress is more and actually anxiety? Well, so stress and anxiety can be different. There can be positive stress and there can be, and anxiety in some ways can be positive. But if it begins to severely limit your abilities or interfere with your abilities to make friendships, to participate in school, to kind of develop or grow in a way that, that you would like to, be able to find enjoyment in life. And that occurs for a certain duration of time. And, you know, with anxieties from a mental health therapist, we look at like 6 months. And if it's causing impairment in your life for at least 6 months, then we would give it an official term or diagnosis of a generalized anxiety or social anxiety or separation anxiety, panic attack, something like that. So it has a name to it, which then helps us be able to really understand, you know, what's going on and how best to help people manage that. I'll let some other people weigh in or take any questions.
This is Shauna. I think you did a great job, Brian, explaining things and talking about it. And I agree 100% everything you said. I would also like to include in just that societal factors. I think what youth are experiencing more and more today is just a bombardment of information that, you know, even 10 years ago we didn't see. And that is a lot to do with just all of the social media and I don't want to discredit how important that is to a lot of youth also, but it seems to me that, you know, there just options for choosing things that weren't there 10 years ago and pressures to make decisions on various things. You know, most recently, my discussions at school have been with pronouns and coming out or not coming out. And then, you know, how well am I going to do on this test? Or, you know, just all of these things that were not as globally discussed, you know, several years ago, a few years ago. And I just think those things are just constantly on students' minds and trying to figure out, where do I fit? I used to more, and I'm trying to figure out where I fit. So maybe this is it. And then, well, gosh, that's not really it. So really struggling, I think, to find just comfort in your own skin, because there's so many things that, there's so many pressures to try to figure out who you are at such a young age, where it's really okay to not know. It's really okay to be in a place where you change your mind, you know, every day, or, you know, every week. It's okay. That's what you should be doing. You should be exploring and discovering, and it's okay to not know. And then a good rule of thumb that I like to talk to kids about, just as far as when do we know it's actually something more than anxiety, is kind of along the line of what Brian said, is when it's impacting you negatively more days than not for a period of time, which is, you know, that's 6 months, that's, you know, a good time to look into doing something more than what you're currently doing, and accessing counseling, or accessing, you know, medical resources. And you don't have to wait 6 months to do that, but it may be time to up the ante with things as far as, you know, resources that you're accessing to help manage those stressors and that anxiety. And it's more so than ever before impacting kids to a great degree. And I would also kind of like to add to a couple of things that I heard some of our young people talk about, is just that fear of talking with parents. I hear that all of the time, not wanting to disappoint parents, not wanting parents to think that they're not doing a good job. And so that is very much part of your reality. And so that just kind of adds to that fear-based thinking about, oh, I can't do this, and my parents are going to freak out. Like, what do I do now? And so, you know, I really appreciate you guys holding this and getting your thoughts out there, and, you know, seeking answers. So great job.
I'd like to just mention a couple of resources for stress-related stuff. First of all, I think it's really important to recognize that all of you being willing to share what you're feeling about stress and about coping and about depression and about anxiety, that you're showing resilience right there, just in your willingness to talk tonight. So thank you for that. And to us all to remember that some stress is positive. We wouldn't get out of bed if we didn't have stress to, you know, the stress of things that we need to get done. It's when it gets to be overwhelming. And I think that Shauna and Brian have done such a great job of talking about that. I'm going to post some resources tonight in the Q&A for everybody, and links to get them. And one of them includes a care card for stress and anxiety that you can use. And so those can be really helpful. Care cards can, and also can the practice simply of gratitude. It helps switch our brains. It's made great gains for people going through anxiety and depression. It's one of those little things that actually makes a big difference. So practicing gratitude changes our brain from scanning the day for the negative to scanning our day for the positive. And it actually physically changes our brains. They've done the brain scans on it. And so those are little things that can be a big help.
And I think I would just jump in and add, on behalf of Idaho Suicide Prevention Hotline, you know, we're talking about youth tonight, and I echo what Kim said. It's amazing that you all have put this on and are talking so openly. It was much different when I was your age, and you know, you are doing amazing work in helping yourself and helping other people in the community. I want to make sure that everybody knows that for the hotline, a person of any age can call the hotline. And I find often that people are surprised in the age range of the people who call or text us. To our knowledge and our history, the youngest caller to the hotline was 7 years old, and the oldest caller was 92 years old. So again, you know, the hotline is there. We are here and ready to listen for people young or old. And it is free and it's confidential. And I just wanted to make sure that everybody knew that they were welcome. I would also say, since you all brought up that it's sometimes difficult to talk to parents. I think that, I think that is some of the young callers who reach out tell us that. And we don't, if someone under the age of 18 reaches out and contacts us to talk, it's going to be confidential. We always encourage young people to talk to a parent, or if they don't have a parent that's that's involved in their lives, we ask, we encourage them to reach out to someone who's an adult in their life. But just want you all to know, and want the community to know, youth in the community, that we are here for you. And if you call us, it is confidential.
Thank you guys so much. I think that was a wonderful conversation on stress. Do any of the other panelists have any other stress-related talking points they'd like to touch upon before we move on to the next topic?
Brian, just real quick, I would just say it is such a big topic and there's so much to it, right? I just, with hearing everybody, it's like, yeah, and this and this. And so I just really encourage you, like, look for those opportunities to talk about it and to find more information, because there's a lot of information, a lot of really good things. So great question to bring up.
Yes, thank you so much. And I think that stress is probably one of the most common experiences that our youth are going through today, and being able to help deal with that and also be able to recognize anxiety and when it's really impacting their lives is a very, very important skill. Thank you guys so much for your insight on that. With our next topic, I'm going to have Sarah read off the questions for isolation.
Okay, so how to combat isolation while staying safe? How can feelings of isolation cause depression? And how can classmates or parents help? How do you judge the level of help someone needs?
Thank you, Sarah. I will now open the panel to discussion.
I guess I'll hop in again and try to start with this again. Like, great questions. And, we honestly, like, I do 8 hours, 10 hours a day on a lot of this stuff. And I'll spend an hour talking about all of this. So it's hard to consolidate all my thoughts, but I'll do my best. So how best to combat isolation while staying safe? So I do think there is a difference between interaction online and, in real life interaction. And I think that it's important to find a balance between that. There are ways, that we can connect with people safely. As a therapist, initially, we had closed things down. And we were doing all virtual appointments. But since then, we probably see about 60% of people I work with virtually and 40% in person now. And so things are opening up, and finding opportunities to do that, finding opportunities outside, I think is really important, just to find a good combination. To be able to, spend time with people online, reaching out to people, but also, to friends, but also find those opportunities to do some in-person, whether it's going for a walk with somebody or a bike ride, or, sitting down, getting Dutch Brothers and hanging out on the grass. I think that's important. And you guys have a lot of shared events, right? Shared experiences. And so being able to share those with one another is important. Feelings of isolation definitely influence depression, and depression influences feeling isolated. the way that it works. So part of depression is feeling like nobody else understands us, like we're a burden sometimes on people, like something wrong with us. Depression is, one way I like to think about it, right, is it's our brain kind of switching to negative mode. Like we see everything in this negative loop and kind of through a negative filter, or a depressed filter really is what it is. And so trying to find those connections, because with depression, one of the first things that often goes are healthy quality connections. We start to pull away from those. And so reaching back out to those, finding those is extremely important. How can a classmate or parents help? Oftentimes when we're depressed, we don't have the energy or motivation to step out. We don't have the courage or the ability to be able to do it. So having people reach out to us is extremely important. Looking out for your peers, being able to say, hey, how are you doing? Question them, talk with them. That's probably one of the things that as a therapist, I wish oftentimes that I could, grab people from the outside and peers and bring them in to help support the person that's down and feeling depressed, because I know that's what they need. They need that connection with their peers. It's extremely important. And then let's see, how do you judge what level someone needs? It's a big question. A lot of it depends on the level of, for me, it would depend on the level or the severity of impairment or difficulty that you're having in your life. So if it's affecting your sleep, if it's affecting multiple areas, we call them domains. So if it's affecting school, your social life, your personal life, maybe spiritual life, those are all like key areas of our life. If it's affecting those, then they need a lot of help. If it's only affecting one, then they probably don't need quite the level or degree of help. They just need to really target that one area or get help in that area. One way that you can get help is, and we are, know this more like from the medical model or standpoint, right, is talk with your doctor. If you've been to your doctor recently, it's likely that they're giving you some questionnaires to fill out. And those questionnaires help them kind of determine where your mood is and what level of help. And so that's one way to get into a therapist, or to see if you might need, what level of help you might need is by talking with them. And they can help you figure that out and make a referral to a mental health therapist, or provide some other suggestions that could be helpful.
I'll just mention that there are resources for helping combat some of the isolation that everyone is feeling right now. And that I think I want to reiterate what Brian was saying about peers looking out for peers, but don't misunderstand that to make you think we expect you to be your peers' counselors. Because absolutely what we need to do is, the best thing you can do for your peers that are going through any emotional crisis, or maybe even a suicidal crisis, is connect them to a trusted adult. Or call the hotline, either one. But, just like you wouldn't try to handle setting a broken leg of your friend if they broke a leg or something like that, which is a health problem. Some of ones who in an emotional crisis may be even more in serious trouble than a broken leg. So we wouldn't expect you to fix that yourself either. So connecting them is really important. And there are some really good resources also for parents, and exactly how parents should try to broach the difficult questions and how to listen well to their kids. And what I've discovered is that since this is a webinar, there's no chat. And since I'm not a panelist actually on the webinar officially, I can't post anything into Q&A. So I'd love to be able to provide these links. I'm just not quite sure how to do it. I'm sorry for the logistics question.
I would like to add to what Brian and Kim said as well, just kind of piggybacking on Kim, especially in that piece of supporting your peers, but not being the counselor for them, and reaching out to somebody else who can do those things, an adult, whether that be your school counselor, your parent, a coach, somebody from church, or somebody that you work with, an adult who can help step in to access resources for your friend, and be the person who can take on some of that responsibility for them. You know, sometimes I think we think our job is to be everything to our friends, and keep those secrets because we don't want them mad at us, or but there's that line that at some point we really need to ask for additional help for our friends' safety, but also for your peace of mind, and feeling like you have this burden yourself to care for your friends, and it's really accessing those resources is the best thing that you can do in these situations where friends are getting to the point where, you know, they're self-harming or doing other risky destructive behaviors, or definitely when they're talking about suicidal ideation, you know, reaching out for somebody who can do those things for you. I am interested in hearing from our youth in what are some things maybe that friends or parents have done to help you guys, like what works for you that helps you feel less isolated or has connected you to feeling like there's hope again. Like what has been helpful for you?
For me personally, it's honestly just been having like conversations, feeling able to share feelings and know that like nobody's gonna like react crazily or anything. Just being able to talk things through and be open, because I feel like just being able to say like I feel really stressed out right now, or I feel super isolated, then you're able to like help work through it, and others can say, you know, oh well, what can I do to help that?
Yeah, I would definitely agree with what Sophie said, just kind of piggybacking on that, like just being open about it and being able to talk about it and, you know, kind of get those feelings off your chest, like Sophie said.
I think something that's personally helped me is friends just randomly reaching out and checking up every once in a while. I actually got a text yesterday from a friend I hadn't talked to in a little while, and it just said, "Hey, I was thinking about you today. How are you doing right now?" And that was really nice to know that someone was thinking about me and cared enough to ask about how I was doing at the moment, even though we haven't talked really frequently. So I've been trying to do the same for my peers as well, and it's been quite helpful.
That's awesome. Thank you, guys.
Can I jump in just real quick? Because maybe, I don't know if I can help with Kim. You mentioned that you had the resources, but you're unable to post them. I don't know if you can email them, maybe even to that thread or that we had going, and then I might be able to pull them off and put them on. I'm not sure I'm that technically sound, but I could give it a try. Okay.
Additionally, we will be going over resources at the end of this panel, and we will be able to try and find a way to post it by then. So if you guys don't figure out that whole issue, we will get that resolved speedily. So thank you guys for that wonderful discussion on isolation. Definitely a very relevant topic, especially with COVID-19 and all the quarantining. So we really do appreciate you guys weighing in on that one. Our next topic up is how parents can help with these situations. And it's not just these situations, it's how parents can help any children that they know that are feeling like they're having a crisis of any kind, or are even just not feeling like themselves. This could range from discussions about suicide prevention all the way back to stress and isolation. So I'm going to have Sophie read the questions for that next one. If we could get someone to change the slide, please.
Yeah, I believe it's just, oh, there we go.
Oh, I believe we don't have any questions for that then. All right. Well, you can give an introduction, Sophie.
Yeah, so yeah, just again, with parents, I think it's a bit of a different situation, obviously, than with peers. I think we've already touched on it a bit, but really what resources are there, or not even resources, what should parents do if they think that their child is struggling?
I can start. And, you know, most of my experiences with younger youth at the middle school level, but I think that, but this is true for any age individual. If you are concerned that your child or your friend or your loved one, no matter what, is struggling with depression and isolation and anxiety, definitely with suicidal ideation, it's okay to ask the question. It's okay to say, hey, how are you doing? What's going on? It's okay if you're thinking, if you're thinking that your child is suicidal, to ask them, are you feeling suicidal? Have you been thinking about this? I think a lot of times it's very scary to ask that because you're afraid of what the answer is going to be, or parents might be afraid that they're going to plant an idea in the, their child's mind. And that's just not the case from my perspective anyhow. In fact, it opens the door for the youth to be like, oh my gosh, somebody's finally asking me this. Somebody knows that this is a real experience for me, and now I can talk about it. And then asking, what have you thought about? Have you tried anything? Just opening those dialogues for the person to be able to respond, honestly, hopefully. And then, if they are feeling suicidal and do have an active plan and are wanting to move forward in those things, the emergency room is probably the next place to go, or to one of our local adolescent hospitals. To have a screening for safety, is probably the best bet. If they're not, if they've had some suicidal ideation but don't have a plan, then really accessing resources with the doctor and finding a counselor, because you're going to need to have some more intensive services probably than just talking with a parent about it. And so, I think just being open and honest and asking those questions is a great place to start.
And I would chime in and also say, I think calling the hotline is also a good place to start. We do get calls. Like I said, we get calls from people of all ages. It's not uncommon for a parent to call us and put us on speakerphone with their child. And sometimes that's the way that they can try to get that conversation started. And like Shauna said, it is so important to ask the question directly, are you feeling suicidal? Without judgment, and just to open that door. And it's really important to use the word suicide and to not say, are you thinking of hurting yourself? Because self-harm and suicide are different things. But we just want again, everybody to know that if you're a parent, you can call the hotline with your child. You can call on your own and seek support for yourself. And we're happy at any time to give you ideas. But asking the question is really, really important. And I think that when we have callers to the hotline and we ask them if they're feeling suicidal, we can almost sense that there's some relief because someone has asked them, and there's an opening for them to be able to talk about it. So I'll stop there, and a little later on, I will give an overview about what happens when you call the hotline, like towards the end of our conversation.
And I'll just add a few things, and thank you both Shauna and Leigh. Shauna, you're absolutely right. It's not just you. Your research backs you up that you're not going to plant a seed if you ask someone. And Leigh is right that you're often met with relief. And part of being willing to open up and ask directly the suicide question creates a barrier to suicide just by asking. Because what you're doing when you ask that question is that it's immediate recognition of the depths of someone's severe emotional pain. And when you ask that question, you're recognizing that you create a sense of belongingness to the person you're talking to. And we know that creating a sense of belongingness helps prevent suicide. It's one of the main things that does. So simply asking the question is not only okay, it's protective. And so I appreciate you guys both mentioning that. And then I've got in these resources that I just emailed, I want to mention that there's a YouTube video in there that's less than 5 minutes long for parents. It's got some great examples about exactly how to talk to your kids and how to open that conversation and what to say and what not to say. So that's in there. And I also just want to mention another resource that is available actually through our federal grant. We have a contract with BPA Health, and they have hired regional case managers statewide to provide these services. And one is that if there is a student who has made a suicide attempt or who has missed school because they have such serious suicide ideation, that this case manager, and this is all for free, is there to act as an advocate for that youth and as a liaison between the school, the youth, the family, and the agency or the provider who saw that young person. And this really goes a long way at reducing sometimes the feelings of shame and blame that can come along with a situation like this, both for the young person themselves and for the family. So that's available for free. And the other thing that's available for free is that if a family can't afford a full suicide, in-depth suicide assessment for their youth, they can provide that as well. And they can provide that if there's any kind of barriers, if families don't have insurance, or if their deductible's too high, if they just can't financially do it, or if they don't have geographic access to a mental health provider, that can be provided to them for free. And I will re-email that phone number since I can't post it. But for anyone listening, it's 208-947-5155. So 947-5155. That's not a crisis line. It's an 8 to 5 Monday through Friday, access to the services that I just described for free.
I would add, so another, a couple other resources I think are really important. And I would love to see like all the parents out there and kids go to and take this class. So there's one on mental health first aid, which is a really good class. And then QPR, question, persuade, refer is the other one. And both of those help just develop a comfort of really understanding how to talk with other people about mental health. We like a lot of us have probably done like the BLS or, basic life support, CPR, we understand the 30 and 2 and those things, but we don't know how to do necessarily the mental health first aid aspect, how there's a lot of discomfort about being able to talk to it. And so those are really good opportunities. And they're good opportunities. I know there are some resources out there that offer those classes free as well. At least I'm pretty positive that there are out there that offer them free. I know they are out there. So QPR and mental health first aid are two that I would strongly, highly would love to see every adult out there and adolescent do.
Thank you so much, Brian. Just to quickly stay on this topic, I have a question. So a lot of times when other youth that I have talked with that are either experiencing suicidal ideations, depression, or anything like that, they want to tell their parents, but they are afraid of their parents treating them differently because they feel like they will be treated as if they are broken, or, they are worried about everyone treating them as a different person. So from a parental perspective, how should they go about treating their children if their children come to them with that kind of issue while still treating it as a serious problem?
I will just mention, and let Brian take over, that it's perfectly okay and acceptable to normalize that everyone goes through tough stuff. Everyone has emotional crises in their lives, and we rely on our strengths to make it through. To normalize that sometimes people think about suicide. We don't want to ever normalize suicide because it's statistically rare. It is not common. Thinking about it, not so rare. It's okay if you're thinking about it, because what happens for the vast, vast majority of people who have suicidal thoughts is that they recover. Very, very few actually die by suicide. And so it's perfectly okay if somebody is thinking about it. So we've got to normalize that, and parents have to make that okay for youth to talk about. And it's okay to talk about their own struggles, not in a comparative way, but to talk about that they or other members of their family went through some emotional crises and were resilient and maybe got some help and came out better on the other side. And even sharing those types of stories from within your own family can help their kids.
I think piggybacking on, oh, sorry, Brian, were you?
You can go ahead. I was trying to do a resource, but you start, Shauna, and then I can jump in after. Thanks.
Okay, just to piggyback on Kim a little bit too, talking about the resiliency and the sharing, that can definitely give, you know, the young person some hope, and part of, you know, coming through the suicide ideation and the depression is finding that hope, which can be so difficult to do, and not just focusing on the traumatic experiences, but acknowledging, yes, this is very, very hard times, and everything that you are experiencing is valid and real, and you know, your emotional well-being is important, and there's hope. So here's things that people have done that's helped them get better. Here's things that I've done that have helped me get better. And some of that is accessing, you know, a counselor. Some of that is becoming involved in things, which when you want to isolate is very hard to do. So I think one of the things that parents can do is really just listening with open ears and hearing the experience that their child is experiencing, acknowledging how real it is, and not diminishing that at all, and then just working together collaboratively to move forward in a way that's going to help have resilience, and knowing that it ebbs and flows too. There's great days and then there's awful days, and one of the things I think that the young people don't want to feel like what you guys are mentioning is, now I feel like I have to walk on eggshells because my parents are hovering over me all the time, and having those conversations about, Mom, it feels like you're hovering now. Like, I'm okay today, you know, I'm doing these things to make myself feel better. So just continuing with that communication between, you know, parent and child will just help both people find balance on how to take care of yourself and how parents can take care of you without, you know, hovering, which is scary. As a parent, I would hover. I would be on top, you know, of my child because of just the love and that protective factor that I want to be able to do. But that balance might take some time, and just acknowledging that.
Yeah, really, I don't know that I can add a lot more to that. I think that you guys covered it all really well. It is extremely important to find those protective factors. Like, what is it that you find enjoyment? What is it that makes life worth living for? What are those things that are important to you? And then as a parent, to be able to help facilitate that. I mean, it's been a time where, you know, sometimes we need help to connect with friends. Maybe a friend lives, you know, that they live in a neighborhood away or on the other side of town or something. Being willing to drive them to that place, willing to have some, you know, set up some date or some way to connect with those people, or go and do some activity, you know, being willing to support that, I think is something that's important and that parents can do. And I have seen it where I'm working with families and an individual who is having severe suicidal ideations, or maybe has attempted, and then parents are trying to understand afterwards and trying to negotiate those feelings and how best to handle it. And one of those things that we talk about is it is important that we provide and nourish, right, those opportunities to grow and to find that you know, that's that purpose in life. And that takes that hope. You know, there's a lot of hope in it, and looking for that, and parents can guide that. That's what parents are there, is to help show the way, and they can do that by being open. Yeah. And I couldn't post either, so sorry.
One more thing that the parent can do, and students and friends, is I think a school is kind of like the starting place a lot of times, where a lot of information comes out at the school, and we bridge the gap to resources, or bridge the gap to parents and communicating that. But also, like, when parents communicate to us, then we can, work on building that relationship with the student and be another trusted individual, but also communicate with teachers with what's going on with students, and making a plan to reduce some of the stressors just within the classroom or in the school setting in itself, and working together collaboratively, just making plans. It has really been helpful to students. Sometimes that includes a shortened day because a full day is too much. And so when we are able to work with the family in these situations, we can do a lot of things just from that school perspective, which is a big chunk of a kid's day, right? So just that communication is really important also.
Shauna, I'd like to add on to that. So I work as a school resource officer, and typically in my school setting, sometimes I'm part of those conversations with families and with counselors and my administrators and things like that. And one of the things that we are doing in the city of Meridian with the Meridian Police Department is launching our crisis intervention team. And so that's something that's going to be a little new for us, in the sense of, typically people think, they call law enforcement and you think of like those 911 calls or those report style calls, but the crisis intervention team's function really truly is trying to help our community members, and that's youth and adults, parents, students, whoever it may be that needs help, to the resources that we do have in the Valley, which could include things like the suicide hotline. It can also include an organization like our mobile crisis unit that's through our Department of Health and Welfare. And so I would also encourage, I know every school and every youth in the city of Meridian has a school resource officer assigned to it. And so if parents or students don't know where to start, don't necessarily think of your school resource officer as that law enforcement officer, because we play different roles in that setting, which could also be, that mentor, counselor, not officially counselor, like as in Shauna or Brian, but something along those lines of, hey, let's help get connected to the right resources to keep our friends, to keep our students, and to keep our children safe. So I would just encourage people to also consider reaching out to their SRO or even our crisis intervention team if they have questions about where to start.
Thank you so much, you guys. And a special thank you to Officer Horvath for that extra resource with the SRO officers. I honestly, as a student, have never once considered the idea of going to my school resource officer. That is a wonderful point. Thank you so much. And kind of segue into that, our next topic is suicide, mostly focusing on youth suicide. And we have how to cope with peer suicide. That is one that I think a lot of youth in our community could, use advice on, because a lot of times there is a conversation around suicide that says we shouldn't talk about it because people won't know how to cope with it and it'll give them ideas. But knowing how to correctly cope with that kind of, or healthfully cope with that kind of stuff is really important. We also have how can we detect suicidal tendencies and how can we help with those? We also wanted to discuss the difference between morbid thinking and suicidal ideation. and how can we help prevent suicide, not just as individuals, but also as an organization with a platform such as MYAC?
Well, I guess I'll start. Thank you for those questions. And I'm going to let some others talk more about the coping part of it, but coping with peer suicide, that it's challenging. And we cope with it the same way that we cope with any other kind of emotional crisis in our lives. And some of those things that we discussed already. Understanding that that's not true for everybody who becomes suicidal, and certainly being willing to mourn their loss, grieve for them, honor the person who died, but at the same time, do things focused on living, sharing stories of recovery. This is something else that you could do as an organization. We know one of the things that helps actually save lives is getting stories of recovery out there. Here's how I got better, as opposed to here's how bad it is. Here's how bad it is stories tend to make vulnerable people feel even worse. But stories of how I recovered, here's how I got better, here's who I talked to, here's the activity that I relied on, all of those things. Actually, other people see those and they think, oh, wait, I've got something I can rely on as well. And that seems kind of too simple, but that's actually how it happens. And so stories of hope and resilience and how people got better from things actually make a difference. And that's how you can help. Also, how you can help individually. Among those resources that I emailed is a brochure just for students and how to help your friends when it comes to suicide. So I would recommend you look at that, and hopefully you guys will be able to distribute those resources as well. And it has a list in there of warning signs to look for. And again, we don't expect you to be their peer counselors. We expect you to be connectors to adults, connectors to trusted adults. And so recognizing those warning signs, peers are in the best position to notice warning signs of their fellow peers, your fellow students. You really are. And so you have an important role there, and your role is to connect them to adults. So all that information is in there. And then, yeah, it's really important too. I'm glad you brought this up. This is really insightful that, you know, morbid thinking is not the same thing as suicide, because sometimes, and it's perfectly common thing for people to think at some point in their lives or different points in their lives, you know, what would it be like if I'm not here? You know, what is that like? And maybe even thinking about your own death. But that's different than thinking of causing your own death. And so that's quite different. So a lot of people, just as one example that the person who trains our clinicians in suicide assessment says, you know, you look over the edge of something when you're way up high, you think about, everyone thinks about, well, gosh, that's really high. If I fell, I would die. And that's just common. That's very common thinking, to think about death, to even think about what would it be like if I'm not here. Those aren't uncommon, but they're morbid thinking, and they're not the same as suicide. So, and I would just open up for Shauna or anyone else who has anything to share about those questions.
I'll just say that, just kind of going along the lines of that morbid thinking, or I often talk with students about it in the sense that it's like an escape fantasy. They're so overwhelmed, and sometimes you think, gosh, if I was never born, I never would feel this way, or if I got hit by a bus today, then I wouldn't have to feel this way anymore. And so really it's an opportunity to talk about how overwhelmed you're feeling and how your coping skills are not matching the stress that you're feeling. And Brian talked about that earlier, about not having the skill set to manage what your experiences are. And that's one of the things that causes a lot of that anxiety and stress. And so and it's not necessarily, it's not suicidal thinking, but just like, gosh, if I wasn't here, that would be kind of nice because I wouldn't have to feel this way. And so those conversations that I have with students, I inform parents of those, because it's very important for parents to be aware that this is how overwhelmed and how stressed and maybe depressed or anxious their child's feeling. And so that just allows them to kind of step in and you know, take some extra care with their child. But I would say that, you know, sometimes if we don't access resources at that place, or give an outlet for somebody to grow their coping skills when they're having that morbid thinking, it can lead to more feelings of isolation, more feelings of depression because they're not able to manage it. And it's possible that it could lead to suicidal ideation. So just, you know, when I have those conversations, it's an important place to start and add some prevention and add some more skills to the students' repertoire just to help, you know, get better and find that hope. So Brian, I'm sure you have some really insightful things to say too. I'm hoping, I enjoy hearing what you've got.
Oh man, well, the pressure is on then. You know, I'll go back and mention mental health first aid and QPR when we're talking about what can MYAC and organizations do, right? What can we do as a community? We can get educated on it. And those are ways to do that. And I think that's important. The more that we're educated, that's why I love this forum and that you guys you know, did this. I mean, to me, it's inspirational, and it gives me energy to keep going, to see positive things like this, because that is what we're looking for. And this is exactly what we need to be able to do, is just to be able to talk about it and to share our care with others, right? And so it's wonderful that you're doing that. Definitely education, get more education. How do we detect suicidal tendencies? So some of those common ones are withdrawal, making statements, right, about suicide, making statements about ending their life, making statements about life not being worth living, or feeling overwhelmed by things. Really difficulty solving problems that seem overwhelming to them, right? That's what it ends up being, is a lot of the inability to come up with a solution to a problem that feels overwhelming. And so the solution that people come up with isn't a good solution. It's just oftentimes the only one that they can come up with at that time. And that's why it's so important to reach out, to talk with other people, because they can help you problem solve it, right? It's much easier to solve a problem if you're able to see it from different perspectives versus just one side. And a little bit on how to cope with peer suicide. I mean, there's a lot there. Everybody's going to be different in how they deal with it. Getting help, seeking help, talking with a counselor, recognition that it doesn't just last for a week. You know, that there's anniversaries that come up, there's memories, there's things that we see that will remind us of that. If there is a completed suicide that occurs, that's something that we'll continue to process, you know, throughout our life. It's not a simple thing. It really takes a concerted effort, right? A purposeful effort to be able to deal with that and to manage it. And if it's not a completed suicide and it's an attempted suicide, it's also a situation that really requires you know, I think some professional support in doing. There are certain ways to talk to people, to be able to understand where they are at, how they're feeling about it. So, you know, reaching out, looking for those resources, both for the individual that maybe had attempted, but also for those that are close to them, to know how to support. SAMHSA, Substance Abuse and Mental Health Administration, has some good resources on there. You can download them, they're free. So that's something that people can look for. It's a library, a wealth of information out there that's really helpful as well.
And I'll just mention too, that was all really well put, Brian. Thank you. And Shauna too, that in addition to QPR, Idaho Lives Project provides its own more Idaho specific training that's like QPR, does kind of all the same things to give people the language to talk to someone, but we spend more time on upstream prevention, focused on hope and help and strength, and giving people lots of information and fodder that they can use to help instill hope. And then there's a lot of more specific Idaho information. And so idaholives.org, or our phone number, which is 208-999-0137, for best practices, for access to that training, for any of the resources I've mentioned tonight, really absolutely anything to do with youth suicide prevention. You can reach out to Idaho Lives, and if we don't have it, we'll connect you with who does, including some of that support for suicide assessments and that follow-up after an attempt.
And I would just add in for the hotline, we get a lot of youth calling us, and oftentimes, they will have had experiences that have been very difficult, including traumatic events in their childhood. And I think that, all of us here on the panel, we're really focused on helping people find resilience. And I think that as far as peers, that's a way you can help also. I think sometimes when a person is in crisis, any type of crisis, including suicidal crisis, they don't see how resilient they are. They don't, I'm thinking of a call I took recently, and it was a young person. And this person had been through some very difficult experiences, and they were really harsh, judging themselves harshly because, why do I feel like this? Why don't I feel better? And it was, this person was incredibly resilient, but they couldn't see it themselves. And so I think as peers, when you have a friend struggling, it's sometimes can be very helpful to say, acknowledge what they've been through and kind of reflect back, like, you are such a strong person. You've struggled the last year, or you struggled when, your grandma died, or you struggled with this or that, and look at you now. Because oftentimes a person, and it's not just youth, adults or youth, any age, when a person is experiencing the crisis, it's really hard for them to see how strong they really are.
Thank you. I think that was really, really well said. Does anyone have any final discussion points they want to talk about with this topic before we move on?
I just wanted to piggyback off of what Brian was saying earlier about like the tendencies. I would also say like a big one would be like talking about giving away stuff, or talking about giving away things that are important to them. Like that was a big one for me. Like both of my 2 tries, I was like, I don't need books anymore. And then I was always like reaching out to friends like, hey, do you want this book? And they were like, that's kind of weird. So I would say that's a big one to watch out for. I don't know. I just wanted to bring that up. So.
Definitely. Thank you, Caitlin. You're right.
Yeah, and another one is, I know this is quite a commonly talked about one, but a sudden change in mood. All of a sudden, very, very, very happy, or just very acting so differently, not like themselves, right up until they take their life. That's what happened with one of my friends. They were very often reserved and quiet and mellow, and then right before they took their life, they just completely changed into a different person, and no one really knew why. And it was very alarming after they took their life to look back and see that pattern and realize that no one had really done anything about it, because no one really had recognized that that was a sign. So yeah, I think that is a wonderful point. Thank you, Caitlin, and thank you guys. So next we're going to quickly move on to resources. I'm going to bring back Leigh, and she's also going to talk about what happens when you call the suicide prevention hotline.
Sure, thank you. So again, if somebody joined late, I just want to say that the suicide prevention hotline is 24/7. A person can call us, text us, or go on our website. There's a chat function, and we're free and confidential. A person of any age can call us. And, you know, the first thing I want to say is that everyone at the Suicide Prevention Hotline, we are trained in crisis intervention. We are not counselors. And so our primary function is to help a person who's in crisis. And it can be due to suicidal feelings, or it can be for any other reason. So crisis intervention is really focused on helping a person stay safe for now. You know, we always like to think of it when somebody reaches out to us, especially if they're feeling suicidal, you know, they may benefit from seeing a therapist, or they may benefit from talking to their school resource counselor or a parent, but they have to get through that day. You know, they have to get through that morning or that evening, so that they can take the next step that can be beneficial to them. So with that said, when a person calls the hotline, our goal, our crisis phone responders' goal, is to help a person, to help you reduce stress, and if for whatever's causing that stress at the moment, and to help you feel empowered about making decisions. You know, some of the other panelists mentioned that when a person's in crisis or feeling suicidal, they can feel overwhelmed and they don't know what to do. And so part of our process is, again, to help you feel like you can reduce that stress, and you can think through and you can decide for yourself what decisions you want to make. It's really common that when a person calls the hotline, they have difficulty speaking, and sometimes they may be feeling panicked, and they have difficulty speaking, and their breathing is accelerated. And so if a person reaches out like that, you know, feeling like that, we assure them that, you know, take their time, you know, take your time, we're here to listen. And sometimes we'll start by asking them if they would want to do a breathing exercise with us. And that can just involve taking, you know, a handful of deep breaths together. And that is an amazing way for someone to kind of self-soothe and really feel grounded. And, you know, most of our function at the hotline is to really listen to the person. And, you know, we will ask you some questions. We will ask you, you know, if you haven't told us already, we might ask you, how are you feeling? What's going on today? You know, and then we want to hear your story. We want to hear what's going on with you. And, you know, at some point we will ask if you were feeling suicidal, because as the other panelist pointed out, it's one of the most important things that a person can do to help another person is to ask the question, are you feeling suicidal today? And sometimes callers will say, no, I'm not feeling suicidal today. I have felt like that sometimes, but it just helps us know how best we can support you in that moment. We also, at some point, the crisis phone responder will, you know, really try to gauge, you know, if you are safe. And sometimes we'll ask you, you know, are you in a safe place? And then again, you know, your response will help us know how best to support you. So basically, you know, we will listen. We may do some breathing exercises with you. You know, when a person calls the hotline, you share what you want to share. You know, you can share as much as you want to share, or you can share as little as you want to share. And again, our goal is to help you reduce stress. And if you are in a situation where you are not safe, then we will ask your permission if we can work together with you to come up with a plan that will keep you safe, you know, for this afternoon, for tonight, you know. And I just want to share just quickly before I stop. When we talk about a plan to keep you safe, that can be so many things. It really, for most callers, it really is a distraction. I think Brian and other people reference that a lot of times people have so much going on, and keeping a person safe in a crisis intervention model is really helping the person come up with a distraction. And so a lot of times, some really common ways that we help keep callers safe. And again, we elicit, you know, ideas from them. We don't tell them what to do, But a lot of times when we help a person identify who their buffers are, or what is, who is supportive in their life, or what do they like to do, a lot of times a safety plan can be, I'm going to talk to my mom, or I'm going to pet my cat, or I'm going to color in my coloring book and listen to music. It can also be, things as basic as, I haven't eaten in a few days and I'm going to eat dinner and I'm going to try to get some sleep. So again, sometimes people think that it has to be something really complicated to support someone. And I know Brian mentioned this at the beginning. Oftentimes a person in crisis or a person feeling a lot of anxiety or depression, oftentimes they're not taking care of their basic needs. So if they say, I'm going to, my plan for today to keep safe is to eat a sandwich and talk to my mom, that can be so powerful. So again, the hotline is here 24/7, and most people are going to experience some kind of crisis in their life. And so we just want everybody to know that we're here for you, as well as everybody else on this panel, and encourage anybody to reach out for help when you feel you need it, because guaranteed in our lives, we all need help at some point. So thank you.
Thank you so much, Leigh. And I'd like to let you guys know, anyone who's watching, these resources that have been discussed today, not just the Idaho Suicide Prevention Hotline, but all of the other ones mentioned by our panelists, will be posted on the Meridian MYAC website, as well as our social media. So you will be able to find those resources listed there. Just wait a little bit and those will be up very shortly. So I'd lastly like to thank our panelists and our MYACers so much for speaking. And for those of you that are watching, thank you so much for coming. This is a very important issue and we appreciate all of your guys' help in making this happen. So I'm going to quickly, are there any final questions? Sorry, just received a message now. All right, looks like there are no final questions. I am going to now bring on the mayor to give closing remarks. Thank you guys so much for participating and interacting with us. We really do appreciate you being here. Mayor Simpson.
Thank you, Hannah. I just want to say thank you to MYAC for bringing this needed resource to the community tonight as we are in Mental Health Awareness Month. The timing is great. The struggles coming out of COVID is great. And I also want to say thank you to our panelists, for being on here this evening and, quite frankly, creating a resource that can be used for years to come in a variety of different ways for our community. This is just one step, but having this here is huge. So just a sincere thank you to everybody who took the time and effort to put this together this evening. And we just all remember that no one is alone and we're in this together. We've all been touched by this one way or the other, directly or indirectly, and we can all make a difference. So thank you for everyone. And we look forward to sharing this with the community in many different ways.
Thank you, Mayor Simpson. That concludes the end of our Mental Health Summit. Thank you guys all for participating, and I hope you have a wonderful day.
Thank you so much.
Thank you.
Great job, guys.
Take care, everyone.
Thank you.